Welcome to the EBLEX Better Returns programme, Lamb Survival DVD. We've put together a series of chapters where we feel management intervention can make a difference to the bottom line of your sheep enterprise, looking at everything from sheep health, welfare and the productivity of your flock.
In the housing section, we're going to look at the overall environment of the lambing shed and also the individual pen to improve the environment for both the ewe and the lambs. Lambing on all farms is different. Some people lamb outdoors, some people lamb indoors, but this is a stressful time, so you need to make sure the design of housing and individual pens is as simple and easy as possible to move the sheep around. You need to ensure that you're able to observe the sheep easily and also be able to intervene if necessary if there is a problem. Placing hay racks in the shed or hurdles can make handling sheep, if you need to intervene, much easier. Lighting in the lambing shed is important. You need to ensure you have either spotlights or plenty of strip lights within the shed to make observing the sheep in the morning or in the evening simple. During pregnancy, sheep require a certain amount of space. The recommendations for a 60 to 90 kilogram ewe are 1.2 to 1.4 metres squared during pregnancy, and with lambs at foot 2 to 2.2 metres squared. Hygiene at lambing time is important both for lamb health but also for ewe health. You need to ensure they have plenty of dry, clean bedding, both for their comfort but also for the prevention of diseases such as lameness and mastitis. To test your bedding, you should walk through the shed and do the squelch tests both through the main areas of the shed and also around the water trough areas. So walk through, and if there's water coming around your boots, then it's too wet and you should apply new fresh bedding. We're now moving on to look at the hygiene in the individual lambing pens. It's important to make sure the pens are kept clean and dry for the prevention of disease. Ideally, you can muck out the whole pen, but if time doesn't allow this, then you can apply lime and then plenty of fresh, clean bedding. All sheep need a fresh, clean supply of water. Lactating ewes have a higher demand for water and therefore they need to have a plentiful supply. Most farmers use buckets. These can be labour intensive and can be knocked over. Some farms have adapted their water system to use a pipe with holes cut in it, which can be easily filled from one end using a bucket or also filled with a pipe feeding into them.
Hello, I'm Claire Fithian. I'm a sheep vet based at University of Bristol, and in this clip we're going to look at some of the lambing preparations and some of the longer term management preparations that have a large impact on lamb survival in the immediate neonatal period. As part of lambing time preparation, it's useful to go through your kit and equipment ahead of the busy period to check you have all the vital components you need. Whether you keep your equipment or kit in a box, in bales, in a shelving unit, there are some key components that all farmers can have, and we're quickly going to refresh on these now. So gloves are a useful part of the kit to consider having. As you all know, it's difficult at lambing time when lambings are coming thick and fast to wash your hands between every single assisted lambing. So whether you decide to use short gloves or long arm-length gloves like these, they both offer a really effective barrier and reduce the risk of you picking up diseases from ewes and transmitting diseases between other sheep and lambs. Handy tip is that the long arm-length glove also acts as a handy scoop for picking up the afterbirth, the placenta, and nice disposable bag there to keep your bedding nice, clean and dry. Check that you've got a plentiful supply of lubricant in stock. And of course, with difficult lambings, dystocia cases, lubricant is a must. For those cases where you've got a dry, difficult lambing, sometimes this type of lubricant can appear just to fall off the lamb. And what can be useful is to obtain a powdered form of lubricant, and it's supplied in these flakes, which you apply by simply patting around the inside of the vagina, then on the lamb. And on contact with moisture in the vagina becomes a more sticky, a more gloopy consistency, and this can be really helpful for those cases, as I say, where it's dry and it sticks to the lamb, where sometimes, as you can see, the other sort of lubricant, as good as it is, can fall off. as well as lubricant. Another handy tip for those difficult lambings is to use a lambing aid, such as a lambing snare or a lambing rope. I've got one of these pre-designed snares here, and with my trusty toy lamb I'll demonstrate. So the idea is that you use your way to palpate and feel the lamb's head, particularly good for those lamb's heads that seem to go backwards, and any knot or any securing device should be fixed securely in the lamb's mouth like that. It's not underneath where it can strangulate, but securely in the mouth. Strong iodine solution, which contains 10% alcohol, which is the drying agent that dries up the lamb's navels. Ideally you want to spray or dip the navel within the first 2 hours of birth, and best practice advice would be to repeat that 4 hours later wherever possible. Rule of thumb is that they should be brittle by 36 hours old. Don't be tempted to go for the tincture of iodine or weaker iodine solutions that aren't as effective for drying up the navel. Stomach tubes, syringes and a supply of colostrum. Best supply of colostrum of course is colostrum. Handy tip is actually to put it into those freezer bag, ice cube bags, and to store those. They're quite easily to defrost. Alternatively, an artificial colostrum supply specifically for lambs, or a pooled cow colostrum. A bottle of 40% glucose, also known as dextrose, with the intraperitoneal or IP injection of young lambs. A bottle of calcium borogluconate, calcium solution for hypocalcemia in ewes. When you use that, use it as a warm solution and inject under the skin, roughly 60 to 80 mils for an average size ewe. A selection of harnesses and spoons for any prolapse cases. And also useful to have is a oral solution or supplement for twin lamb. A selection of sterile needles and syringes with a selection of different sizes, different gauge needles. Antibiotics, as directed by your veterinary surgeon, might be useful to include some long-acting preparations. Also, really consider the use of anti-inflammatories, essentially painkillers, which are very effective for reducing the pain, inflammation associated with conditions such as dystocia, difficult lambings, lameness, mastitis. Really useful to think of having that in your lambing kit. For treating entropion in young lambs, as well as having a needle and syringe, you might like to consider using Michael's clips, entropion clips, which come in a pack like this and are applied with a set of forceps. Other equipment to have handy is a warming box if possible, and of course a kettle or portable urn. Some form of recording lamb performance. So a handy notebook like this is useful to carry in the back of your pocket and to record any lambs found dead and any known or diagnosed reasons why. And not forgetting your vet's telephone number and the telephone number of the AHVLA close by. Getting the lambing kit together is of course only a small part of your preparations for lambing time. Most of the management preparations and action will have been targeted 5 months ago at tupping time. The focus of all that management was of course the delivery of live lambs of a good birth weight that are developing a good ewe-lamb bond. The development of a strong ewe-lamb bond and good mothering ability is affected by a number of factors such as ewe nutrition, body condition, general health status and genetics, as well as factors of the environment such as the amount of space at lambing time and the level of supervision. Clearly a ewe that lambs unaided is of good body condition and health that's left alone as long as possible at the site of birth offers the best opportunity to develop a strong ewe-lamb bond. Ewes have a strong sense of smell and bond strongly to the site of birth, which sometimes is why they can be very difficult to move to the individual pens. Obviously, staying at the site of birth isn't feasible for every farm and mismothering can be an issue. Therefore, moving to individual pens of a good size is a next practical option. It's common sense and of course familiar to experienced shepherds that the sooner a lamb stands, bonds the ewe and sucks colostrum, the greater its chances are of surviving the neonatal period. The first milk, or colostrum, contains an essential source of energy and fats, in addition to antibodies, which are the first line of defence in the lamb's immune system. So it really is the fuel for life. The gut of the newborn lamb is very efficient and adapted to absorbing colostrum in the first few hours after birth. This ability diminishes over time and a phenomenon known as gut closure occurs, whereby about 12 hours old, lamb's ability to absorb the colostrum antibodies are very much reduced. So if you have any doubt about the lamb's intake of colostrum in the first few hours, a good rule of thumb is to administer 50 ml per kilo of colostrum substitute, ideally eucolostrum, by stomach tube. Eucolostrum should be yellow and thick in consistency, almost like clotted cream. If it's thin and watery, and or you're experiencing particular problems with watery mouth and joint ill, as well as looking at the hygiene in the general environment, the cleanliness at lambing time, it's worth looking into ewe nutrition pre-lambing and body condition as well. Body condition scoring is a vital tool to every sheep producer, and particularly so for the pregnant ewe. A really useful time to actually body condition score ewes during the mid-pregnancy period, such as a scanning visit, which offers the ideal opportunity to get your hands on the ewe's back. Body condition scoring used together with scanning data can be used to feed the ewe appropriately according to the number of lambs and also her condition. It's important to manage the body condition score of ewes throughout the production cycle, and particularly in the pregnancy period, so that at lambing time they're neither too fat or too thin, as this can be associated with particular conditions such as vaginal prolapses, dystocia and pregnancy toxemia. As well as preventing and controlling vaginal prolapses, the prompt treatment of any lameness and mastitis cases that occur at lambing time will help improve ewe health and optimise the expression of maternal behaviour, all of which of course have subsequent benefits on lamb health, welfare and production. In this clip we're going to look at the key signs of good health and welfare in young lambs and look at treating some common conditions that may arise. The key signs of good health and welfare, which will be familiar to most people, are the general demeanour of lambs. Are they bright, alert, responsive, or are they quiet, dull, depressed, miserable? A good sign of a full belly of milk or colostrum is when a lamb stands and gives a good stretch. Standing ability of young lambs is a good indicator of health, whether they stand squarely in four legs or if they've got any signs of wobbliness or recumbency, which can be an indicator of hypothermia, starvation or conditions such as joint ill. As well as demeanour, the general posture of a lamb can tell you a lot about it. So is it relaxed? Does it have a tucked up abdomen? So hunched tucked up posture can indicate signs of abdominal discomfort, starvation or hypothermia. Looking at the abdominal fill of young lambs can tell you whether they've had a good belly full of milk, or do they have a hollow appearance indicating that there's a lack of milk or colostrum. On the other end of the spectrum, you can get lambs that appear very, very bloated. Frequently they're seen in orphan lambs when they've gorged on the milk. The gait and general appearance of the joints of lambs can tell you a lot about their health and welfare status. Do they walk freely, or do they have a stiff gait and enlarged joints, which may be suggestive of joint ill? Other areas to assess would be the mouth and eyes. Firstly, for signs of salivation, excess salivation, which can be a sign of watery mouth, and not the frothing of milk that can occur after a bottle feed. Examine the eyes for any evidence of tear staining. Does the lower eyelid appear to roll inwards in the condition known as entropion? And is there any cloudiness, whiteness over the surface of the eye? Most of the key signs we've covered so far have been based on very physical aspects of health and welfare. But there's a really key sign of health and good welfare in young lambs, and that's play behaviour. These signs can clearly be used to identify good health and welfare in young lambs, and also those lambs that may require treatment for particular conditions such as hypothermia, starvation, joint ill and entropion. Next, we're going to look at some of the ways you can treat these conditions. Let's take a close look at hypothermia. Clearly, a lamb that's shivering in front of you is easy to spot as a cold lamb. But for those cases where you have a dull, tucked up, hunched posture or flat out lamb, it's useful to take the temperature there. The normal rectal temperature of a healthy young lamb is between 39 to 40 degrees Celsius or 103 to 104 degrees Fahrenheit. A lamb with a rectal temperature of 37 degrees Celsius or below would be classed as severely hypothermic. These lambs are often flat out and comatose. The way that we treat hypothermia in young lambs depends on the age of the lamb. That's because young lambs are born with a brown fat supply, which is essentially their energy supply for the first 5 to 6 hours of life. So, for lambs aged 5 hours or below, we use its own brown fat as its energy supply and warm the lamb up first. For warming up lambs, it's preferable to use a warming box which heats up the air around the lamb and is a more efficient way of heating rather than using a UV lamp which can overheat, dehydrate the lamb and can scorch lambs. So if you do use a UV lamp, check the height and check that lambs can move out the way and are not too hot. Once the lamb's warmed up, remove it from the warming area and place it either in a hospital pen or back with the ewe for closer observation, and then stomach tube it with colostrum. So just a quick refresher on stomach tubing. Stomach tube the lamb in as a relaxed and natural position as possible. Try to avoid stretching the neck out too far, as this can encourage the tube to go down the windpipe, which is obviously what we don't want. A useful tip, particularly for smaller lambs, is to measure from behind the elbow to the tip of the nose the length of the stomach tube that you need to insert, just as a rough guide, because often that's quite long for a smaller lamb. It might be useful to keep a set of stomach tubes in a pot of warm water, just keeping them soft and pliable. And you can lubricate the tip as well before inserting them. A last little tip is a lot of the baby feeding equipment equally applies to young lambs, and the bottle warmers and baby sterilising solutions can equally be applied for using on stomach tubes. As a general guide, a lamb requires 200 ml per kilo of colostrum in the first 24 hours of life. If in doubt, you haven't seen the lamb suck colostrum in the first 2 hours or it's appearing hollow, then administer 50 ml per kilo by stomach tube. For lambs older than 5 hours old, we need to give more aggressive treatment, and that's because we assume that the brown fat supply is being used up. Without this essential source of glucose, the brain struggles to function properly, and the end result is that we have a comatose lamb which doesn't respond to standard treatments of stomach tubing, colostrum milk, or warming in the warming box. For these lambs, the technique of intraperitoneal injection or IP injection really can be a lifesaver. Essentially, the technique involves administering a warm glucose solution into the peritoneal cavity, and this is a space between the intestines and other vital organs in the abdomen. This is a good way of getting glucose into the lamb as it's rapidly absorbed from the peritoneal cavity. It really is a do or die procedure and is an emergency lifesaver for those lambs that are comatose and flat out. The IP injection, you'll need a bottle of 40% glucose, also called dextrose, recently boiled water, and a needle and syringe, and I'd recommend using a 19 gauge 1-inch needle. Draw up 10 to 15 ml of recently boiled water and an equal volume of the 40% glucose to make up a 20% glucose solution. I'll demonstrate the IP injection using this model lamb. So hold the lamb by the front legs. By doing so, the vital organs will move away from the area you want to inject into. To identify the correct position, find the navel and work 1 inch below and 1 inch to the side. Either side's fine. And we're going to place our injection in that site, aiming downwards at a 45-degree angle towards the tail. And then you're going to insert the needle right to the hub and inject slowly. And here's where the landmarks are on the live lamb, 1 inch below and 1 inch to the side of the navel. Following the injection, place the lamb in the warming box, and as previously, once it's warmed up, give colostrum by stomach tube. If you're not completely confident after the demonstration, then have a go at practicing on a dead lamb or maybe a toy lamb. For lambs over 5 hours old that are mildly hypothermic, they can be given colostrum by stomach tube and then returned to the warming box. For lambs with watery mouth or diarrhoea, in addition to any treatments recommended by your vet, be aware that these lambs often have considerable damage to the intestines. Therefore, stomach tube and electrolyte solution first, and then give milk feed several hours later. Lambs such as this one with joint ill require antibiotic and anti-inflammatory treatments as directed by your vet. Navel dipping can be an important part of preventing joint ill. In addition, we know that the common bacterial causes of the condition are found in the environment. Therefore, as well as maintaining optimal hygiene conditions, it's important that lambs receive a really good supply of colostrum. The final condition we're going to consider in this clip is entropion. It's a condition which lambs are born with, whereby the lower eyelid is turned inwards. So check the eyes of newborn lambs for these rolled in eyelids. In older lambs, you might notice some that are holding their eyes tightly shut, or with tear staining and eye discharge. And all of these can be indicators of this condition. You can imagine just how painful it must be to have the inner eyelashes constantly rubbing against the front of your eye. Therefore, it's important that we treat and try and prevent this condition too. It's possible that entropion is a genetic condition. Therefore, along with lamb performance records and other flock records, you might identify a particular ram involved to try and prevent this condition reoccurring next year. So the case of entropion like this, where you've got turning in of the lower eyelid, there's two main treatments available. So one option is to give a subconjunctival injection, which is essentially putting a bleb of a substance such as antibiotic like penicillin, which is quite oily, or another oily based substance such as liquid paraffin into the area here to pull on that lower eyelid and turn it out. So you're going to put your needle parallel to the eyelid and you're aiming for this skin here, and you're just going into the skin and underneath like so, and just going to put a bleb of antibiotic there, roughly about 1/2 ml. And as I do that, you can see that that area is starting to enlarge, and it's just pulling out that lower eyelid. So we've got another case here of a lamb with entropion, and as you can see, it's holding its eye quite tightly shut. It's got signs of eye discharge and tear staining, and quite clearly you can unroll that lower eyelid. So we're going to demonstrate an alternative method of treating entropion, which, as you can see, can be done single-handedly, and that's the application of the Michaels metal entropion clips. So just as before, you hold the eye open, invert lower eyelid, and you apply the metal clip to that excess skin underneath. In less severe cases, a single clip will often hold that eyelid open, but in more severe cases like this, it's useful to use 2 clips slightly positioned apart to hold the lower eyelid. And so you can see that that lower eyelid is now rolled out. The clips stay in place until they ping out when the skin under the eye grows.
In this section, we're going to look at lambing records and how through recording losses you can improve your lamb health, welfare and production. Health planning is not about ticking boxes and filling in forms. It's about identifying avoidable physical and financial losses. Recording lamb losses may be depressing, but it's useful information to improve the health and welfare of your flock and make changes for the future. Through using a notebook such as this, you can record various things from what date the tups went in, how many tups went in, and how many ewes you've actually tupped. And then moving on to scanning, you can put the date that you scanned, the group that you scanned, the number of barren, singles, twins, triplets, etc. And then moving on to lambing time, you can record if you've had any ewe deaths and why you may have found what the reason was for those, and make a tally. Hopefully you don't have too many. And then lambs, you can also record a tally as to why lambs were found dead. So whether you record it in a flock notebook such as this, on a wall chart or a flip chart, a blackboard, or even through EID, whichever you find easiest for your system, but if you record these losses, you can identify where the weak areas are on your farm and put procedures in place to implement changes to improve your following season. You can use these records on animal performance to make changes to your system, such as changing management practices, modifying the environment, setting up control policies such as vaccination, and devising a protocol in case of a disease outbreak. The number of ewes tupped is the total number of ewes or ewe lambs put to the ram. The scanning percentage is the number of lambs scanned divided by the total number of ewes put to the tup. The lambing percentage is the number of lambs born. You should compare this to the lambs scanned. This will show lambs lost during pregnancy through absorption, abortion, or which were born dead. This indicates health problems such as underlying abortion or nutritional deficiencies. When compared to the number of lambs turned out, this indicates possible health problems, hygiene issues, or insufficient colostrum intake. The rearing percentage is the total number of lambs sold, whether as stores or as finished, and if there's mortality in this period, these would be related possibly due to poor worm control in the pasture or diseases such as coccidiosis. You can use these animal performance records along with the information from this table to compare how you've done compared to the national average, and then you and your vet can implement changes for your system to improve things for the following season, to decrease your lamb losses and improve your bottom line.
In this clip, we're looking at how investigating any losses at lambing time can be used as a tool for improving lamb survival and wider lamb health, welfare and production. We're going to specifically focus on neonatal losses and to use a basic on-farm post-mortem to be able to rule out key causes of loss such as hypothermia, starvation and infectious disease. So let's take a closer look. We found somewhere suitable to perform our closer exam. We've got our lamb, we've got a scalpel or a penknife is fine. A bale of straw makes quite a good post-mortem table covered by a feed bag, and we've got a bucket of water as well for later. EBLEX has prepared this worksheet, takes you step by step through some of the basic post-mortem points, and I'm going to go through this now. Before we start making any cuts or looking at the lamb in closer detail, of course it's important for me to remind you of the zoonotic risks that are involved in roping up any dead animals and dead lambs at this period. So any concerns regarding abortion cases, stillborn lambs, lambs with deformities, please contact your local veterinary surgeon and involve the diagnostic services and expertise of your local AHVLA veterinary laboratory. Obviously it goes without saying that pregnant women shouldn't be involved in lambing flocks, and particularly true for involvement with post-mortem material, protective equipment, clothing and your gloves. This basic on-farm method is not the same as a gold standard post-mortem service and diagnostic investigations that can be performed by the AHVLA. The worksheet is designed to take you step by step to be able to answer some of the key questions, which are: was the lamb born alive? Did it breathe? Has the lamb ever stood? And has it taken a suck of colostrum or milk? As with all post-mortems, the sooner you can perform them, the better. The carcass can deteriorate pretty quickly. If you have some scales handy, it's useful to weigh the lamb. As a general rule of thumb, lambs under 3 kilos might suggest that undernutrition of ewes and a lack of body reserve, whereas lambs over 6 kilos are generally at a greater risk of lambing difficulties and dystocia. First things first, start by examining external appearance and the coat of the lamb. Has there been signs of it's been licked by the ewe? And is there signs of bright yellow staining of the coat, which is the meconium staining and is an indicator of stress during birth. At the same time, I'm running my hands over, just checking whether there's any swellings, any damage, obvious injuries or wounds, and any scorch marks, perhaps from a UV light that's been pretty close. Then a look at the feet. Newborn lambs are born with a slipper-like membrane over the soles of the feet, and this starts to wear off as soon as they start to stand and bear weight. So we know in this example that this lamb died at grass and it has walked, and you can see that there's no evidence of that slipper and the hooves are clean. Next, examine the navel for any signs of swelling, any thickening, any bleeding, which can be an indicator of navel ill, and check whether it's been dipped or sprayed with iodine. And in this example you can see that the navel has quite clearly fallen off. It's been treated with iodine and there's no obvious abnormalities. Next, have a look at the head and the eyes for any signs of swelling or congestion or enlargement. I've got another example here we're going to have a look at. So in this case it's clearly a large lamb. It's covered in a meconium staining, it's bright yellow on its fleece, indicating it's suffered fetal distress. And if you look at its head, you can see it's quite clearly enlarged. Its tongue's hanging out and swollen. And if you look at a close look at its eyes, they're heavily congested, all indicative of a difficult lambing. Also clearly shows freshly born navel that hasn't been treated there. And the fact that the lamb's never walked, still has the slippers covering the soles of its hooves. And compare this to the lamb that has walked, you can see the difference, this soft, slippery membrane compared to the normal sole. And finally, take a look just to check that the lamb does have an anus. Let's open up this lamb first. So roll him onto his back. And just to keep him steady, we're going to make 4 incisions under the armpits and in the groin, just to loosen the tension there. And there. Next, make a long incision starting from the throat down to the groin, trying not to enter the abdomen at this stage. Now just start to peel back the skin. You can use your knife or your hands. We're going to have a look inside the chest, so let's open up the rib cage. The easiest way to do that is to find the sternum. Pop your finger underneath it and then cut around like so, and then just feel for the junction where the bone and the cartilage of the ribs meets. It's pretty high up in lambs and that should be easy to cut with a penknife or scalpel in this stage, and flip the rib cage back. And then you can see the heart and lungs. So have a look at the heart for the presence of brown fat. Brown fat's found round the heart and the kidneys, and it's present in all newborn lambs. And it's essentially an energy source that they can use in the first hours of life before they've had that colostrum feed. So if you see a case where you have a young lamb that's dead and it hasn't got brown fat appearance looking like this, but it's much more of a pink colour, or it's been used up, then it gives you a pretty good indication if, along with the fact that there's no colostrum in the abdomen, that lamb's died of starvation. Next, look at the lungs, and we want to rule out whether this lamb has ever breathed or not. So, if we look at the colour of this lamb's lungs, they're a very dark red colour. A normal healthy lung of a lamb that has taken a breath is usually more of a salmon pink colour, and this darker appearance indicates that this lamb has never taken a breath, so it never breathed, it never lived. If in any doubt if the lamb has taken a breath or not, just take a sample of lung, chop a little bit off, like so, and pop it in a bowl of water. As you can see in this case, the lung is sunk, indicating that this lamb never breathes. In a case where a lamb has died and taken a breath, the lung would float. Next, cut into the abdomen, just trying to avoid cutting into the stomach at this stage if possible. There's no signs of free blood in the abdomen. The liver looks normal, no signs of rupture, which can be seen in cases of dystocia. Then next, just pull all the organs back, and you're looking for the kidneys, and specifically the brown fat that surrounds the kidney. And this is a really good example of brown fat that hasn't been metabolised. And just like the brown fat that's found around the heart, this is an essential energy supply for the lamb. To answer our final question, has the lamb ever sucked colostrum or milk? Have a look at the stomach, the abomasum. In this case, we know that the lamb never survived past the birthing process and never stood to suck milk, but let's look at the stomach all the same to give you an idea what it looks like. You can see it contains this almost jelly-like substance, and that's the normal appearance of the inside of the newborn lamb's stomach. So we're now going to open up an older lamb and compare that with our previous case. Compare the brown fat around this heart with the one we saw previously. You can see the brown fat in this case, the older lamb, has been used up, it's been metabolised. And this is a good example of what normal lamb lungs look like. And this more salmon pink colour of the lungs indicates that lungs have been aerated and this lamb breathes. But let's take a sample all the same and check. There's a clear difference from the lung that's come from the lamb that's breathed before dying, and you can see that this piece of lung floats on the surface. Compare the brown fat which has been metabolised around the kidney in this lamb with the earlier case that still had the brown fat present. And to check whether this lamb has been sucking milk, I'm going to open up the abomasum. The abomasum should be full of clotted milk, and obviously a creamy white consistency in here. In this case it clearly isn't, which would suggest that this lamb has died of starvation. By the end of this demonstration, hopefully you'll have some additional tools to be able to answer those key questions. Was the lamb born alive and breathed? Did it stand? And did it take a good suck of colostrum or milk? As part of recording the reasons for any losses at lambing time, hopefully this demonstration will allow you to target management and resources to improving lamb survival in the future. It's certainly worth trying this out for those lambs where you don't know the reason they've died, or they've been laid on or lost at the field. But certainly don't force diagnosis, contact your veterinary surgeon and use the clear expertise and support offered by the AHVLA.
Thanks for watching. I hope you've picked up some practical tips or used it as a useful refresher to reduce your lamb losses and improve your returns.